Hey everyone, so today's video is going to be about malocclusion in chinchillas. This is actually what happened with Scooter and why he had to be euthanized. So this is kind of going to be like my own personal account of dealing with malocclusion and just going based on what my vet and the specialist said, as well as one of the rescues in the area that's close to me. It's definitely becoming a common problem with chinchillas, and they don't really know exactly what causes it. Some people think that it's diet, some say that it's genetic, some say that it's age, so they don't really know exactly why it happens. And I'm also going to go over some things that you should be watching for when you own chinchillas. Since it can happen at any age, you want to make sure that you're always watching their behavior and how they're eating and how their poops look and everything like that. Back in about November, I noticed that Scooter wasn't really eating like he normally did. He was kind of pawing at his mouth when he was chewing, and he wasn't really eating much hay. He wasn't a big hay eater to begin with, but I noticed that he wasn't eating pretty much any hay at all. He would still take treats and food that he liked and stuff like that, but he took a really long time to finish any of it. Goji berries were his favorite, and he used to just suck them down really quickly. But then I noticed that he was having to kind of hold them in his hand for a long period of time and chew on them. Another thing that I noticed was that he was drooling a little bit. So in the corners of his mouth, he would have some hard fur from his saliva. I had been warned to watch for these symptoms and that he probably was going to be diagnosed with malocclusion, so I did take him to the vet that specializes in small animals. And once we were there, Scooter got a head x-ray as well as a mouth exam, and the doctor did confirm that he had malocclusion. By definition, malocclusion is a problem in the way of the upper and lower teeth and when they fit together during biting or chewing. The word malocclusion literally means bad bite, and when it comes to chinchillas, it's often taken into reference with the elongation of tooth roots as well as the point of the tooth tips, which are usually referred to as tooth spurs or burrs or just tooth tips. So when you take your chinchilla to the vet, ideally what's going to happen is the vet's going to want to look inside of the chinchilla's mouth. And a lot of exotic vets will use this specific tool. I'm not sure what the name of it is, but it just forces open the rodent's mouth. They use it on guinea pigs and rabbits and rats and stuff like that. It just kind of pinches the front teeth and opens up like tweezers, so it forces the animal to open up their mouth so the vet can get a look at what's going on inside. It looks awful and most of them don't like it, but Scooter did really well, and afterwards he was acting fine, so I knew that it didn't hurt him. When the vet is looking inside of the mouth, this is when they're actually going to be inspecting the top sides of the teeth. They're going to be making sure that everything is lining up, that the teeth appear flat, and that there's no spurs or points or anything or any kind of broken teeth. These can actually be fixed pretty easily though. The vet can just either clip or file down the teeth, and chinchillas can actually live a long life if they have malocclusion on the top parts of their teeth. You'll just have to periodically bring the chinchilla back into the vet to get the teeth filed down or clipped to make sure that everything aligns up properly and that they're able to eat on their own. The next step is checking the root system of the teeth, and this can only be done by an x-ray. So if you're going in suspecting malocclusion and your vet doesn't suggest an x-ray, then I would ask them to get an x-ray done. Ideally, you should be getting 3 x-rays, one of each side of the face, and then one is going to be the bottom. Sometimes I've seen where they do like a front side as well to check the front teeth, but you can also see that on the 2 side views. If the x-rays are done properly, then this is not going to harm the chinchilla. However, Scooter did have to be on a local anesthetic just so he wasn't moving about and everything like that. This is what the 2 side view x-rays look like, and it's really interesting to see a chinchilla x-ray because their bones are so thin and teeny tiny, and their head is so massive, but it also kind of looks like a bird at the same time. So as you can see in this x-ray, the big white parts are the teeth and the molars, and you can definitely tell that the molars have kind of grown into the jawbone as well as the upper jawbone and almost into the eye area. This is malocclusion at its worst when it's growing into the jawbone as well as the ocular bone and the eye. It's extremely painful for them, and unfortunately euthanasia is usually suggested. I have heard of actual tooth removal, and my vet kind of also suggested it a little bit to me, but when you can see these x-rays, this is an x-ray from the bottom of the head. Once one tooth starts growing and gets impacted, then all the other ones shortly follow. So after I had talked in length to the rescue that's near me, she's had hundreds of chinchillas over the years coming and going throughout her facility, and she doesn't suggest removing any of the teeth. The surgery is really hard on the chinchillas, and in the end, it doesn't really help that much, and the problem can just come back. So what we opted for was bringing Scooter home and just keeping him comfortable until he lost 10% of his body weight. So he was on pain meds for about a month and was kind of eating some softer foods until it just got too bad and he had lost too much weight, and I could just tell that his quality of life wasn't there anymore, and we decided to go ahead and euthanize him. Some things you want to look out for are weight loss due to them not being able to eat normally, as well as selective eating. I had mixed two different types of pellets, and Scooter would only pick out the softer version that I had in the bowls. He was also pawing at his mouth while he was eating. This is common during the first stages of malocclusion, and you may even notice some fur that's been worn away from their paws or their chin area as a result of them pawing at it. As I mentioned before, not eating hay like they normally would, as well as not using any of their chew toys. And then some will kind of hunch up just because that's what chinchillas do when they're in pain, or kind of huddling close to their cage mates. Another thing to look out for just in general with chinchillas is any type of small droppings, because that means they're not eating what they're supposed to be eating. And then further on, as the malocclusion gets worse, you may notice some discharge around the eyes, as well as, the drooling a lot. Scooter didn't really have much, but that was one of the first things that I noticed just because he normally had a really nice coat. As a dental disease gets worse and the roots grow more and more, you'll start to notice more discharge from the eyes since the roots are growing into the eye and sinus cavities, and sometimes it's a whitish fluid coming from the eye. And then on this skull here, if you look at both the bottom and the top jawbones, especially the bottom, you can actually see the teeth roots growing into the jawbone, and you can actually feel that if you just rub your finger along the bottom of your chinchilla's jaw, and if you feel any bumps or any type of foreign objects, it could possibly be the tooth roots. Just remember that your vet has to take an x-ray in order to officially diagnose the chinchilla with malocclusion. Just because you're feeling some bumps or just because your chinchilla has some discharge doesn't mean that they have malocclusion, so you definitely want to make sure that you're taking them to the vet and not treating them on your own. Remember that this is extremely painful for them, so getting them on pain medication is going to be probably the #1 thing, and you'll have to go to the vet to get the pain medication. So as I mentioned before, they don't really know exactly why malocclusion happens. I've even read that the different color mutations have a higher chance of getting malocclusion, as well as a chinchilla on a low calcium diet. And then I've also read some articles that if you catch the malocclusion quick enough and in the early stages, if you up their calcium, then you can prevent this from happening. But on the flip side, a lot of people say that this is not true and that it's just pretty much a genetic disease, or it can be a result of a bad diet. However, I would rather be safe than sorry and avoid giving your chinchilla any type of food that's got seeds and treats in it. Any type of high sugar shouldn't be offered to them at all. Chinchillas in general have a pretty strict diet compared to other rodents, so I would make sure that you're following a chinchilla diet to the T and making sure they're not getting any type of foods that they shouldn't be getting. But I hope you guys liked this video, and just a reminder, this is kind of just my experience with malocclusion after talking to my vet and everything. I have no medical training whatsoever when it comes to animals. So if you notice anything wrong with your pets, then I highly suggest taking them to the vet. But if you have any questions, go ahead and comment below, and I will see you in my next video. Thanks for watching.